Well, a joyful heart is good medicine, but a broken spirit dries up the bones. I actually took that off Proverbs 17:22. You know, many people in the world deal with mental health challenges caused by a variety of factors. The world today deals with many depressed people living with suicidal thoughts and tendencies. In an age of COVID-19 pandemic, there have been more cases of mental health challenges, and it's high time the world understood what's on our hands. Welcome to VSA. I'm Sulaiman. The government expenditure on mental health in Africa is low, at less than $1 per head. As many fell into depression, mental health services for women, children, and male adults dipped and sent a lot of people into dangerous sports. Mental health access in Africa is still lowly subscribed to. As many popularly say, depression is not an African disease, yet millions of people are losing their minds. There are less than 2 mental health workers per 100,000 Africans, right? A very low comparison with 9 mental health workers by 100,000 people in the advanced countries of the world. Currently, about 100 million Africans suffer from clinical depression, and more than 60% of them are women. In the words of the WHO, a mental health challenge is the greatest thief of a productive economic life. The problems have been identified, but people don't even know they have these problems. How can a mental health challenge be detected? What are the pointers? Are the signs visible? Our guest experts will be answering these and lots more today on VSA. Well, pretty much later, Bukola will be joining me here in Nigeria. But again, Dr. Sulaiman Teferra is a psychiatrist from Ethiopia. Good to see you, Dr. Teferra. And I recall you've been with me on the program, a few times talking about mental health. I'm so excited seeing you again.
It's my pleasure. Nice to see you again.
Now let's start by, breaking it down for every, especially African listening and watching. Time was when some still think that mental health is not an African thing. They think that it's way outside the continent. But with experts like yourself, even though we still deal with having more like yourself handling what we're dealing with, how would you respond to such comments when you hear people say, this is not of us as Africans?
Thank you very much. Thank you very much. I think this is a very obsolete comment nowadays, as we have plenty of evidence from Africa showing we are not spared from the predicament of mental illness. In fact, Africans are suffering not only from mental disorders, but from multiple problems and ill health. And especially what makes the challenges in Africa very difficult is less than 10% of those people who suffer from mental disorders have access to modern mental health services. So not only we have a big mental health problem, we also have very limited access to services. So that's what complicates the issue of mental health in Africa.
We'll come back to the issue of access, to mental health. And I'm happy that you've also been able to tell, Africans that that's now an obsolete, thinking or comment or impression about mental health on the continent. Now, some of the key things people have been trying to look at, top on the list, poor economic conditions, relationships, responsibilities, and other factors could actually send one into a mental chaos. how can a person sinking into depression be observed? Well, looks like I thought I lost you for a bit. Are you back, Dr. Teferra?
Yes. I'm on.
Oh, great. Good. Even if I can see you, at least I can hear you. So quickly, since you can hear me, I'm asking how we can actually identify someone who's actually getting into depression.
Yeah. So depression is one of the common mental disorders, and it has distinct manifestations. When someone develops depression, the predominant features are depressed mood. So the person starts to exhibit extreme sadness and loss of interest in pleasurable activities. And then usually it's a change in behavior from their usual behavior. For instance, they usually isolate themselves from friends, families. They lose interest in work and other productive activities. Their productivity diminishes significantly, and they lose interest in general in life. They lose their energy and drive to keep going. So they may engage in suicidal thoughts, and up to 15% of people suffering from depression will eventually commit suicide. So it's a serious mental disorder which really results in loss of life.
And quite frankly, I'm trying to understand if when you made mention of depression, that's something that sometimes can be a little bit misplaced in its usage. Perhaps maybe we should also start by getting the expert's opinion of what depression is.
Yeah, depression is, as I said earlier, it's different from the usual, low moods that we experience on a daily basis. It's different from feeling low or sad fleetingly. It is a persistently depressed mood most of the day, nearly every day for at least 2 weeks. So this is one of the criteria we use for diagnosing depression. And loss of interest in previously pleasurable activities, meaning a person who used to enjoy watching movies will lose interest in watching movies. A person who used to enjoy reading will lose interest in reading. And there will be changes in appetite, weight, in sleep, concentration, and then the mental acuity will diminish. The person will be slowed mentally and physically, and they have an extreme and exaggerated guilt and sense of worthlessness, and eventually they think about dying, or they may even contemplate about killing themselves, and then suicidal attempts are common in depression. So it's a serious mental disorder. It's not really, just a brief experience of sadness or low mood. It's different. It's a mental disorder with serious consequences.
I think the key word there is serious consequences, and again, you've also been able to establish it that it goes beyond feeling low. And again, there is a pattern that one should also observe that stays for a number of days. Let me quickly bring in Bukola Lamid, who is a mental health professional here in Nigeria. Bukola, thanks for joining us. And we've actually started talking with Dr. Sulaiman Teferra, who's been able to give us clear-cut definition and, understanding of what mental health is about. Tell us, looking at what the world is, dealing with at the moment, the world already has a day set aside for mental health. It shows the importance of that to our being. But again, Nigeria is way behind in its awareness. There are just 350 psychiatrists treating more than 200 million people. Is training more professionals the way to start? Bukola.
Thank you for having me. Hello, everyone. Okay. So, hello to the psychiatrists online as well. I really enjoyed your conversation around mental health. So now looking at the question that you asked, because we have so many myths around mental health, especially in this part of the world. So it's becoming, it's been a bit challenging for us to put across what mental health actually is in this part of the world. Because when you hear the word mental health, a lot of people already have this kind of definition around it, talking about psychosis or anything like madness, pardon my use of word, and things like that. So we are looking at actually trying to create a lot of awareness first for people to understand what mental health really is. Because there's a definition by World Health Organization who they expressly, clarify that good mental health is your own ability to be able to deal with everyday stresses of life. So the inability for you not to have that skill, results to mental illness. So we need to start from there, and that is what professionals around Nigeria is trying to do. We are trying to create a lot of awareness to first of all let people understand what exactly mental health is and how people can, work around the skills and coping mechanism, because mental health is for we all have mental health, and it is our responsibility to make sure that we take care of our mental health. And then it is important for us to know what mental health actually is, because you cannot take care of what you don't know. So it's not really about trying to get a lot of professionals or trying to acquire more professionals. The professionals that we have already, we are trying to reach out as much as we can via our social media platform, trying to do a lot of awareness locally, the grassroots and all that. Because even if we have a lot of professionals and we are not even bringing those information out there, it doesn't really make any difference. So we are very, very passionate about this, because we realize Nigeria being a very peculiar nation, looking at everything that is happening in our nation presently, a lot of people are anxious, Doctor spoke about depression. A lot of people don't even know what depression is. People even throw the words around, oh, I'm depressed, oh, I'm depressed. A lot of people have a lot of misinformation around depression, because you can be sad for a long time and you don't have depression. So a lot of people misconstrue prolonged sadness with depression. So it's still part of the education that we're trying to put out there, that before you can even be confirmed that you're depressed, we have to clinically prove it. As a psychologist, we have to do some assessment to understand that, okay, yes, this person has been sad for over 3 months or more than 3 months, before we could say, okay, this person is getting towards, and that should be consistent sadness, okay? So it's not that you're sad today and tomorrow you are up, and we're talking about consistent sadness over a long period of time.
All right, okay. Let me bring in, Bukola, quickly, let me bring in Dr. Teferra. Thank you, Bukola. Sorry for butting in. I need to bring Dr. Teferra in here. And because you both have actually touched on something. On a daily basis, Dr. Teferra, and the same thing Bukola has said, we meet people who make us think that they are depressed. And we use the word loosely. And I'm happy, Dr. Teferra, you've been able to tell us what exactly depression is more serious. And let us in on some, life experiences as a professional, because some say they have met people who are bubbly, who hide their problems to the extent that people don't get to know that these people are unwell mentally until something really, really dire or serious, occurs. How can families and friends around such people get to understand that somehow the young man or old man or woman who seems so happy and well-to-do is mentally unwell? Dr. Teferra.
Yeah, thank you very much. I think it's not easy to detect, when someone develops mental disorder, unless they start to manifest behavioral change or emotional changes that are easily identifiable by people around them. There is a phenomenon known as masked depression. Some patients even may not show it while suffering internally. In this case, people have to be vigilant about subtle behavioral change and observe the pattern of conversation they have with family members. It can be a little bit difficult with young people, especially teenagers. When they develop depression, they may manifest it as behavioral change, which is related to development. So people think, this young man is, or this girl is, changed because she is, she has become adolescent. So they confuse it with developmental change. So people have to be really carefully observe the change, not only in the behavior, but in emotions. Young people can be easily irritable. So one of the manifestations of depression in young people, especially in adolescents, can be irritability instead of feeling sad or depressed. So this is one of the major differences between adults and adolescents. So irritability and the pattern of their thinking when they express some hopelessness that could trigger a concern from immediate family members. So it's multidimensional in a way. It's not only focusing on one aspect, but looking at the individual's changes in personality, in relationships, in interests and in passion. And then all these things indicate the presence of some form of mental disorder. So any change they observe in the family member has to trigger the concern that there may be a mental illness issue developing.
Well, Dr. Teferra, thanks for making that clear, because it will mean that friends and families, everyone must be, so attentive, to details about, each and every one of us. Otherwise, you just might miss it, not knowing full well what someone is dealing with until an expert like yourself or Bukola comes in. Bukola, you used, I like the fact that you said, well, apologies when you use that word madness, knowing full well that, yes, it's one of the key things we'll be talking about here on the continent. A lot of people have been so stigmatized. I'll bring that same question to Dr. Teferra, but again, let's come to you first. It's probably the most stigmatic word used in Nigeria and maybe on the continent. How have you been able to deal with it? Meeting, people, creating awareness so that we can understand that there are some words and, language we mustn't use in trying to pass the message of mental health, so that we don't make people run away from what exactly we should be embracing?
Okay, so it's been a word that has been in existence for a very long time. No, so now let me start this way. In our own context, anything that we don't understand, anything that seems a bit abnormal to us, we push it and we stigmatize it. Okay, so a lot of times things we don't understand, and because, like I said, because of the peculiarity of the environments that we live in, anything that we cannot really put words to or we can't define, we just push it to the spirituality. So that's where you now hear, okay, someone has been inflicted with madness or something like that, because people don't really understand what is happening. So they don't even know the definition. So it's easier for them to push it to the spirituality or just find a name and, capture it like that. So madness is very harsh word. And really it's something we could call maybe something like schizophrenia. And it's not actually madness like what people say. It can be treated. Most mental illness can be treated, okay? But because people don't even understand what exactly is wrong with this person, and because over the years, looking at the history of psychopathology or psychology or psychiatry in this part of the world, we've had so many ways of dealing with mental illness in our own way. Going through the history, you'll be amazed at what people have done to people who have these illnesses, because they don't believe that it's actually more or less like a medical condition as well. Because once something can be treated, it actually can be classified as a medical condition. But a lot of people don't know that. And like you said earlier, that's one of the things that we are trying to push out. There's something we call stigma in mental health. So we have a whole lot of information around that where we are trying to change the narrative. I give you an instance. So we don't say someone is depressed. We would say someone has symptoms of depression. Because when you say someone is depressed, it's like you're stigmatizing the person. So we are trying to change the language on how we use all these very sensitive names of forms of mental illness. So we are getting there. Sometimes when we are in the public and people speak, we try to educate them. Education is everything, and we are trying all we can. And thank God, for this kind of platform that we are. And I know a lot of people are listening to us. And, a lot of people are beginning to open up, because it starts from you understanding how you feel per time. Before it gets to that level where people start putting all those names on you, you have to understand how you feel, why you feel what you feel. Mental health is basically trying to understand the reason why you're feeling in a particular way and what triggers it. So once we're able to start from that, very, very basic level, it's easier for us to take it a notch higher from there. So that is how it has been. We cannot change the narrative over time, overnight, but we are trying, all mental health practitioners, psychologists, psychiatrists, we are going out there, we are doing a lot of, information, awareness, a lot of awareness. Even today, we've done a lot of things in my own organization, trying to, push this information of mental health to the world. Now it's everybody is talking about it. Even people who are not people who are not professionals, they are advocates, they are enthusiastic. Everybody is trying to join the force and trying to push out the healthy narrative of mental illness out there.
Let me bring in Dr. Teferra to weigh in on the same issue, and again, if you can, to also help us put it on a scale when we talk about mental health, which sits atop this scale of mental unwellness, illness now, so to speak, so that we can get a better word to describing it and see how much of an issue we're dealing with as a people.
Yeah, I think we have in our book, which we use as a diagnostic reference, It cites more than 250 different mental disorders. Some of them are common mental disorders, while others are relatively rare. For instance, anxiety disorders affect different forms, from simple phobias up to 40% of the population, whereas in schizophrenia or bipolar disorder, about 1% of the population is affected. So we generally classify mental disorders into common mental disorders and severe mental disorders. So the severe mental disorders include, as I said earlier, schizophrenia and bipolar disorder, whereas in common mental disorders, you get different forms of anxiety disorders, and depression is also among the common mental disorders, which can affect 5 to 10% of the population, according to several studies, including in many African countries, including my own country, Ethiopia.
So for families on the continent, they have a whole lot they're dealing with at the moment. And again, if you look at it on the continent, I don't know if that also obtains in Ethiopia. It would seem as if government is still also not doing enough. For instance, why do they cite most of the mental or the psychiatric hospitals far away from the cities? So don't you think it's sort of, number one, give people the impression that this is something dangerous to be cited amongst, the community? It puts the people, it gives the people the impression that, well, these people who are also part of us aren't fit to be amongst us. How are the hospitals cited in Ethiopia? Let's start with. Let's see if it's quite different from what we're seeing in other parts of the continent.
Yeah, I mean, I have had the opportunity to visit more than 10 African countries, including Nigeria. And it's pretty much the same, in sub-Saharan Africa, the condition of patients with severe mental disorders. Again, I'm focusing on patients who really are just at the tip of the iceberg, because the majority of mental disorders do not really manifest in the severe forms that we see on the streets. People really can be, civil servants or private employees or business people or farmers, whichever profession they have, they may not really look like they have mental illness. So they dress well, go to work, interact with individuals, but they suffer internally. So the majority of the individuals, in fact, some studies, for instance, in the US, showed severe mental disorders account for less than 10% of patients that visit hospitals. So the majority of patients really need services close to where they live, integrated in the general hospitals and health centers, instead of building asylum-like institution far from cities. The model now advocated by the WHO is integrated service in the general health sector to minimize stigma, because in Ethiopia, for instance, we celebrated the World Mental Health Day on Sunday, which is celebrated every year annually. And the slogan this year was mental health for all. Let's make it a reality. So that means availing mental health services for everyone where they live at an affordable price, or we, in fact, advocate free availability of mental health services. So just to reflect on the situation in Ethiopia, there have been positive developments recently. So we have also launched our 5-year national mental health strategy, and I had the opportunity to participate in the development of the national mental health strategy. And in our strategy, we clearly put integration as a way forward. We are not advocating building, big asylums outside the capital city. In fact, we have managed to integrate basic services in many hospitals and health centers. We have implemented what the WHO suggested. It's known as the mental health gap action plan, or there is an intervention guide. So the mental health gap intervention guide has been implemented, meaning training has been given to general health professionals, doctors, clinical officers, nurses were trained and supervised by mental health professionals. So these professionals provide the services in the general health care setting instead of putting patients in specialized facilities which are really subjected to high levels of stigma. So I think the model advocated now is integration, which really is happening in my country.
Okay, we'll take a moment. When we'll come back, Dr. Teferra and Bukola Lamid, we'll talk more about integration, talk more about what WHO says about one person dying from suicide every 40 seconds, and how can people identify such person so that help can be sought. That's when we return. You know, in most workplaces, the environment has been dubbed toxic for many, and this has affected the state of their minds and general health. If you just joined us, this is VSA on News Central Television, and we have experts looking at the World Mental Health Day. Dr. Teferra is in Ethiopia and Bukola Lamid in Nigeria. Before the break, we've been able to establish some of the key things about stigma, about an inclusive form of treatment and attention for everyone who's sought mental health from experts. And of course, they've also been able to let us in on what it means to be depressed or have symptoms of depression. Let's wrap this by looking at some of the key things here. I did say we were going to ask questions of, those the WHO said commit suicide. Bukola, help us here. The WHO says one person dies from suicide every 40 seconds, and that's really, really a big shock. How can people around such individual identify the person who needs help?
Thank you. So just like what the psychiatrist said the other time, sometimes it's a bit difficult to decipher, to know who has suicide ideation. We call it suicide ideation. So, but there are signs, we need to first of all understand what determines your own mental health. If you can identify what determines your mental health, which includes your attributes such as your ability to manage your thoughts, your emotions, your behavior, your relationship with others. So when you see that it's a bit declining, then you begin to notice, you begin to observe, okay, like social withdrawal. This person who has always been bubbly, suddenly is just withdrawn to themselves. You know, the signs are there. Someone who keeps talking about probably death, somebody whose affect is just sad, someone who keeps talking about how worthless or how useless or how hopeless the world is, and these things that they say is consistent. So you have to look at the intensity and the consistency of all these things. Okay, so that can give us an insight into the symptoms of suicide. Sometimes it doesn't show, especially in our adolescents, you know, it's always very difficult to, you know, find out. But if you are very observant, especially for parents, for adults who are around this adolescent, you can easily, you know, pick cues, easily pick some abnormal or unusual behavior of theirs so that you can quickly address, you know, the issue. Because you see, the situation in the society today has made an average Nigerian to be vulnerable to mental health risks, you know, as a result of the poverty, high prices of commodities, insecurity, like I said earlier, kidnapping, insurgencies, a lot of things, unemployment, and exposure of these are adolescents to substance use, domestic violence, sexual abuse, and stress. Those are the common things that trigger mental disorders like depression, anxiety, and all that. But, you know, people can actually Google. These things are out there. You would know, you know, the signs are out there. When, like I told you, someone who has been consistently sad, you know, somebody who doesn't see the world as somewhere that they can stay, you know, all those things just play out. And if we are very observant, it's not only professionals that can, you know, look out for the signs. As an individual, you can look out for the signs in an individual or young adults or even an average Nigerian. Because you see, everybody is prone to have mental disorders if we are not careful, and if we are not very, you know, very careful of the things that crosses our mind. You know, I say this jokingly to people. I say everybody somehow we have like what we call the 1 minute madness. But you see, it is okay not to be okay. But what is not okay is to stay in that realm, because if you continue to stay in that realm, then it affects your mental health. I mean, once in a while, we need to have anxiety and to put us in order. We need to have a bit of fear to put us, you know, to guide us and put us in check. But when it is consistent, when it is continuous, then it becomes something that we have to, you know, be wary of. So these are the signs.
Let me jump in here again. Apologies, I like jumping in. Let me jump in here again. And, you know, off the top of my head, Dr. Teferra, quickly here, we've seen what's going on the continent, Nigeria inclusive, and some are asking if bad leadership and low productivity as well as poverty are also triggers to, you know, what people are going through in terms of mental health. You know, apart from all of the things Bukola has said, let's now talk about governance and see if it does have any relationship with what you're dealing with as an expert when people come before you.
Thank you very much. I think in Africa, as you know, we're rich in resources, but there is extreme poverty. And that could be due to bad governance, as you rightly say. And there is plenty of evidence relating poverty to different mental disorders, especially depression. Depression and poverty are highly related. And then we have studies that have come out from the African continent done by experts within our continent that clearly demonstrated the role of poverty and depression in Africa. So that is beyond reasonable doubt. And the issue of deprivation and the lack of hope, especially for young people, can be the reason why so many young people commit suicide as well. We have a huge unemployment among the youth and in extreme poverty and deprivation. And this is really related in the most part due to extreme, corruption and lack of good governance. Otherwise, everybody knows Africa is a very rich continent.
I'm staying with you, Dr. Teferra. Some of the questions we received when this went out that you and Bukola will be on the show has to do with women dealing with postpartum depression. Some are still trying to find out why this is so and how they get in the form of expert attention. Have you had any of your patients or anyone before you going through postpartum depression?
Is it for me?
Yes, Dr. Teferra, yes.
Yeah, thank you very much. Again, this is one of the common issues that we deal with in women. In fact, more than half of the women develop what we call postpartum blues due to hormonal changes immediately after giving birth to a child. But that usually improves on its own. But 5 to 10% of women who give birth develop what we call postpartum depression. And there are many explanations why women develop postpartum depression, but the most common explanation is sudden hormonal change and underlying vulnerability for mental illnesses. Women who develop postpartum depression have some family history of mental illness.
I'm staying with you, Dr. Teferra. Some of the questions we received when this went out that you and Bukola will be on the show has to do with women dealing with postpartum depression. Some are still trying to find out why this is so and how they get in the form of expert attention. Have you had any of your patients or anyone before you going through postpartum depression?
Is it for me?
Yes, Dr. Teferra, yes.
Yeah, thank you very much. Again, this is one of the common issues that we deal with in women. In fact, more than half of the women develop what we call postpartum blues due to hormonal changes immediately after giving birth to a child. But that usually improves on its own. But 5 to 10% of women who give birth develop what we call postpartum depression. And there are many explanations why women develop postpartum depression, but the most common explanation is sudden hormonal change and underlying vulnerability for mental illnesses. Women who develop postpartum depression have some family history of mental illness, some psychosocial stressors related with a pregnancy and the childbirth, a lack of adequate social support, and all these contribute to the development of postpartum depression in women.
All right.
So I encountered women who experienced postpartum depression, and it's really very sad to see a mother neglecting her child. Some mothers even develop what we call infanticidal behavior, meaning they attempt to kill the child. So this is one of the extreme behaviors that we observe in postpartum depression. There is what we call passive infanticide, where the mother refuses to breastfeed the child. So that's one form of infanticidal behavior. But extreme infanticidal behavior can involve trying to kill the baby by, for instance, suffocating the baby, or just putting a pillow on the face of the baby. I have encountered such instances in my clinical practice. So it's not only for the mother, but the baby's life is at risk. So what we usually do is advise families to separate the mother from the baby until the mother recovers. So this is really a serious condition.
Bukola, I want you, I could see the official, impression when Dr. Teferra was talking. Looks like you want to add to what he said before we wrap up with some form of, strong solutions to some of the key things that the continent is dealing with.
Okay, doctor has said so many things around PTSD, and I just want to talk about some positive ways how people can deal with PTSD. Like what he has mentioned, the hormonal imbalance of women sometimes can trigger PTSD, maybe after postnatal, or it could be genetic and all that. But, aside from that, like what we were discussing earlier, people need awareness, people need to know, because looking at it from Nigerian context, people, stigmatize PTSD to be, I have to mention that word again, madness, okay? So it's not really madness, it's just a kind of mental disorder that is happening to that woman right at that moment, and it's not something that she could, control. So people listening should just understand that it is just a normal mental disorder that can be, treated. So there are positive ways of coping with this PTSD. If anyone is listening now, first and foremost, we must learn about what PTSD is. And it's, again, it's very important for people to join support groups where they can find other people who have experienced something like this, so that they will know that they are not alone and it's not an absurd ailment or illness or disease, So there are other ways like practicing relaxation, because in as much as we're talking about this diseases or disorders, we should be able to procure solutions to a large extent on how to help people deal with these things. It's one thing for people to know, it's another people to have information on how to deal with it. I mean, this thing happens every day to a lot of women out there. So if we have people listening to us, we should just let them know that they should not stigmatize women who are going through this. It's just a mental disorder that, fades away with time, with good, healthy support, So that's what I intend to add to that information Dr. was saying.
So, Dr. Teferra, quickly here, in the absence of enough experts like yourself, are there alternatives to mental health challenges?
Yeah, I think what the WHO has promoted is the task shifting and task sharing model, where general health professionals can be trained briefly for a few days on the basic skills to identify different mental disorders and provide treatment, including prescribing medication and providing talk therapy. So the good thing about mental illness, they are not expensive. If there is a goodwill from the leadership, it can easily be made available. Antidepressants can be produced in the African continent. For instance, in my country, the common antidepressant medications are manufactured in the country, and they are not that expensive. So we can provide services integrated into the general health care by the general health care professionals. What it requires is providing the basic training they need. In fact, one of the innovations of the WHO is the MH-GAP intervention guide, which was developed for non-mental health specialists. This was developed because of the huge gap in the need and services. We cannot provide services using psychiatrists. To give you an example, the Sub-Saharan Africa region, which has a population of over 1 billion, has only about 1,000 psychiatrists. While if you go to the US, which has a population of a third of Africa, they have more than 50,000 psychiatrists, but they talk about shortage of psychiatrists even now. So you cannot have enough psychiatrists in 100 years. So the only option we have is task sharing, meaning training general healthcare professionals and availing the basic medications and the basic talk therapy, which can be easily provided. The other option is tackling barriers to care. It's not only availing services that will solve the problem, because in my country, we have seen a situation where we distributed different antidepressant medication to the general health centers, trained the nurses and clinical officers, but the patients were not coming. So we lost a good amount of money when the medications that we distributed to hundreds of health centers expired because there was no one coming to use this medication. We really had to learn the hard way by losing the meager resource that we had, and which was really also a challenge for mental health professionals to advocate. So we embarked on a campaign known as demand creation, meaning people have to be aware of mental illnesses, they have to be aware of available services, they have to be aware that these conditions are treatable, effective interventions are available. We have to engage in anti-stigma campaigns and also the misconceptions about different medications, because there are lots of wrong information circulating in the community about these psychotropic medications, and there is a lot of resistance from the community to take these medications. So we really need to do a lot of awareness creation activities.
In closing, one last one here for you, Dr. Teferra, quickly here. For everyone who goes for what they call a general medical checkup, which some do yearly or every 6 months, would you subscribe to a mental health check as part of what everyone should undergo?
Yeah, I mean, in the developed world, you have, if you Google, you have different questionnaires that you check yourself on with some precautions. Of course, you may end up, over-diagnosing yourself, because it's not like a blood pressure measurement. A mental health status is, it's a spectrum. So some conditions may mimic normal experiences. So it needs some precaution, but I think the best way to check our mental well-being is to be vigilant about our feelings. So how am I feeling? To be vigilant about our behavior, especially social behavior, motivation, our perspectives on life, and our interests. The other aspect that we need to look at is our productivity, so and in functioning. So these dimensions can be really observed by the individual. Anyone can just sit and reflect on these aspects: emotions, thoughts, functioning, interpersonal relationships, and so on. So, and a general sense of a feeling of accomplishment and well-being. So these are really complex concepts, but people can really check on themselves how they are faring in life. But going to a mental health professional every 6 months or every year to have a mental health check is not really recommended at the moment. It's not like a physical health condition where you have a clear evidence that if you are past age 40, you are highly likely to develop high blood pressure, or you have to check your blood sugar, and so on. We don't really have that kind of recommendation for mental health, but individuals can engage in mental wellness activities. For instance, eating a balanced diet, engaging in regular physical exercise, having healthy social relationships, and avoiding alcohol and drugs. And this kind of, mental health promotion activities can prevent the development of mental disorders. Otherwise, such prescriptions may not really be,
Well, Dr. Teferra, many thanks, because it would seem that I think just to put it in another way, it looks like mental health is the intangible health of every individual. So first, you have to do that introspection on yourself and ask yourself some key questions. And again, for those around you, they can also help out to see who does need experts like yourselves. Thank you for being the light today, Bukola Lamid and Dr. Sulaiman Teferra. Speak up, speak to someone close to you. That's what we've gotten from today's conversation. Depression is real, and a mental health challenge isn't madness. So you better get that. Let's improve the world and our society. Thanks for watching. See you again. Bye-bye.